So what is the state of COVID like right now? We're going to look at some articles here that's going to discuss it. Now, look, what I'm saying is backed by articles here. I'll use some science where applicable, and all links will be in the description below. So you can go ahead and read behind me, make sure I'm not skipping over something or manipulating anything. But I say all that to say this. I don't know what is or isn't allowed on certain platforms. So if at any time you see that I posted a video and it's no longer up on YouTube, or there are parts that seem to be cut out of it or something like that, we're on Rumble, BitChute, Odyssey. Check us out there. I do intend on always uploading the full shows and segments of the shows there as well as I can. That way you can check them out there. So if something is cut from, say, YouTube, it should be available on one of the other platforms. If I have to cut it in order to stay on YouTube, I'll definitely do that because, again, want to make sure that the reach is out there. Not so much making videos for views and clicks, but really trying to get out there and get the views for, to get the message out there, to get my perspective, my perception, and real news out there, not just what's shared in the mainstream media. So if you do like what I'm doing, if you have enjoyed the content, really consider giving it a like, a subscribe to the channel. And, if you know somebody that might enjoy it, share it with them. Click on that little share button down there. And, if you don't like what I'm doing, comment below. Let me know. Let me know how awful I am. All right. So first article here, just going to skip through, skim through a few of these as quickly as we can. This is coming from AP. Israel study, fourth vaccine shows limited results with Omicron. So what we're going to do is we're going to build a little bit of a case here. We're going to build a little bit of what the current status of COVID/Omicron is right now, where we're at. So just hang tight with me as we kind of build this house, or we build the sandwich, or whatever it is that we kind of build up to, so you can see the full picture. So again, first article from Israel Study saying the fourth vaccine shows limited results with Omicron. All right, so we're seeing that. Let's move on. From Mint, Omicron COVID variant displaying higher vaccine resistance, says senior doctor. So we see that again, right? Moving on. Fox News, CDC's Rochelle Walensky admits poor messaging on COVID guidance, vows to improve. Let's check out some of that.
President Biden insisted on Tuesday that this was nothing like March of 2020, but here you have long lines at testing sites. You got Broadway shows shutting down, sports leagues hitting pause, holiday parties being canceled. A lot of folks are worried. What do you say this morning, Dr. Walensky, to all the people who are panicking right now?
There really is no need to panic. So we now know that about 73% of cases in the United States now are Omicron, and that we expected this because we have seen the doubling times of this virus in other countries have been really rapid, and that's what we've seen here in the United States.
All right, so a few things to unpack there, and that was just before the holidays. But we were talking about the CDC and their messaging. So here we're saying, we expected Omicron to surge. We knew that was coming because we saw this evidence in these other countries. So we were able to be aware of it, to be looking for it, to know it was something that was on the horizon. And don't worry, it is spreading, but we've got it handled, right? We've got it handled. So these are things that were said by the CDC, not necessarily true. And coming back to bite them a couple of times, because there seems to be either the CDC or the Biden administration or the media, whoever it is not on the same page, because we are definitely getting conflicting stories left and right from different sources. Let's check this one out. In the New York Post, it says Biden now says no federal solution to COVID crisis. Would have given out tests quicker if Omicron surge expected. Well, hold on now. We just heard from the director of the CDC that the Omicron surge was expected, right? And then Biden says there's no federal solution, but yeah, he spent an entire debate and campaign criticizing Trump for not having a solution. Doesn't make a whole lot of sense. Let's hear it from the horse's mouth.
Mr. President, the microphone is yours. Thank you, President Biden.
He said, thank you very much, Ace. Look, there is no federal solution. This gets solved at a state level. I'm looking at Governor Sununu on the board here. He talks about that a lot. And it ultimately gets down to where the rubber meets the road, and that's where the patient is in need of help.
Now, he has said multiple times that the rubber meets the road, the buck stops with him, whatever. He is the one that has the responsibility and should be taking that on. But he's passing it on to the states now. It's almost like he's offloading the responsibility of this virus. And then the thing he says there again, just like it says here in the New York Post, he says that there's no federal solution. So I don't understand what's changed. I don't understand why it's saying that we expected it when she says we did expect it, and he says we didn't expect it. You know what? Let's watch this clip.
Dr. Walensky, you just said that we knew this was coming. Why then weren't more of those at-home testing kits secured and made available en masse, even perhaps right after the Delta surge or during the Delta surge? Why does it appear as if we were caught a bit flat-footed with regards to testing capacity specifically?
We've learned about Omicron just over Thanksgiving or just prior to Thanksgiving around the end of November. In areas of high demand, including New York, we're setting up more new federal PCR testing. That, of course, includes a $3 billion investment. The administration is doing a lot with regard to 20,000 sites where you can get a free PCR. And we recognize we have more work to do.
Yes, there certainly is more work to do that the federal government should be doing, could be doing, the CDC could be doing. But the question was, if we knew it was expected, why didn't we go ahead and order more test kits and be prepared? Because right now there's a shortage, right, of home test kits, other test kits, whatnot. And as you saw in my little montage there of her answering the question, she never answers the question. She talks about all the other things they've got going on, but she never answers why they were not prepared when they knew that the surge was coming. Let's take a look at this. All right, from MSNBC, Biden's free COVID test plan through private insurers is a mess. No doubt there. New rules requiring private insurance companies to cover costs for at-home COVID tests are already exposing big problems. Gotta love it. Let's go on down here. Again, I'm going to skip around. Feel free to check it out. Links in the description. Here's how the policy works. Under the new rules, as of January 15th, private health insurance companies must cover 8 at-home coronavirus tests per person every month. An insurance company can work with a partner distributor to create preferred locations where a customer can pick up tests for free, paying nothing out of pocket. What counts as preferred location will vary based on plan. Customers who don't go to the preferred location will need to pay out of pocket and then submit paperwork and receipts to get compensated. Because of lack of clarity and guidance, some health insurance brokers are even advising their policyholders to keep their boxes the tests come in as proof of purchase. The compensation for purchases at non-preferred locations only covers $12 per test. The Kaiser Family Foundation has found tests can cost as much as $50. If an insurance company doesn't arrange for any preferred locations, customer will need to submit receipts and paperwork to be fully reimbursed. This policy setup not only demands that people know about the plan and a bit about how it works, but also requires them to reach out to their insurance provider to figure out what benefits they are eligible for. As Natalie Scher wrote for the New Republic, figuring out how she could get free tests this weekend by contacting her insurance company was a huge hassle. So this is how she tried to find out what would work and what wouldn't work with this new policy. I'm going to read this and we'll move on. After being transferred 3 times, I was simply informed that they'd reimburse me for tests. I stopped to clarify. Will they reimburse full freight for any test? Or do they have a preferred vendor where we can get them for free? I was put on hold for several minutes while whomever I was on the phone with scurried away to find the answers to the obvious question his employer hadn't prepped him for, after which I was finally told that their partner pharmacy is Walmart. According to Google Maps, I live a 39-minute drive away from the nearest Walmart, or a whopping 1 hour and 23 minutes away by public transit, unless I make that trek, and it may not shock you to hear that I won't. My reimbursement requires me to save receipts, fill out paperwork, and mail it to my insurer if I want to get paid back less than half of what I paid for my last test at CVS. By the time I hung up the phone, the call had lasted 38 minutes. So it's clear to see that even the insurance companies aren't prepared for this and don't know what's going on in some regards. Let's take a look at this article here. So again, kind of building a case here. Follow along. Let's see. From CNN, Supreme Court blocks nationwide vaccine and testing mandate for large businesses, allows healthcare worker vaccine mandate to take effect. Now, we did talk about this in I want to say it was the last show, where great questions coming from Amy Coney Barrett and others that are on the Supreme Court asking about, how long this is going to last and why we should be doing the mandate, why it's legal, why it's not legal, and really go into blows with all that. And they did a great job with here. I believe in finding that middle ground or finding that compromise or whatever, which again is something Congress should be doing. But, it's all or nothing for both sides. They seem to forget that they're there to compromise and find a better way, because not everyone in the United States is a Democrat. Not everyone in the United States is a Republican. And even those that are Republican, a lot of them aren't 100% Republican. And some share views with Democrats and vice versa. But yet they won't compromise. It's going to be all or nothing of their bills that they push. In situations like this, whether you are happy with this or not, excuse me, I think it's great that there was some compromise found. Again, they did block the mandate for large businesses, but they allowed healthcare worker vaccine mandates to take effect. And for those that work in the healthcare field, there are vaccines that are required of them. My wife used to work in a hospital and she had to get the flu shot. Never got the flu shot, never had the flu. Started getting the flu vaccine, started getting the flu. I'm not saying there's a correlation there. I'm just pointing out what happened with her. Reading on down here, because there's some folks that gave their feedback. Okay. I'm disappointed that the Supreme Court has chosen to block common sense life-saving requirements for employees at large businesses that were grounded squarely in both science and the law. Remember that. This is for safety of employees grounded in science and law. Science. Keep that in mind. Okay. Let's see. Moving forward, Biden said it is now up to states and individual employers to determine whether to make their workplaces as safe as possible for employees and whether their businesses will be safe for consumers during this pandemic by requiring employees to take the simple and effective step of getting vaccinated. When we are wise, we know not to displace the judgments of experts acting within the sphere Congress marked out and under presidential control to deal with the emergency conditions, they wrote. Today, we are not wise. In the face of a still raging pandemic, this court tells the agency charged with protecting workers' safety, OSHA, that it may not do so in all the workplaces needed. As disease and death continue to mount, this court tells the agency that it cannot respond in the most effective way possible. The most effective way possible being mandating the vaccines. Keep that in mind. They're saying they're following the science, and the best way to protect you and your coworkers is if you get the vaccine. Keep that in mind. Again, we're building this sandwich. We're building this up. Okay, stay with me. All right. Let's see. All right, so we already read that Omicron is vaccine resistant, though, right? So catching it is still very likely. We read last week where Fauci and others are saying it's basically going to be to the point where everybody's just going to get it more than likely. Okay, so they're saying here, hey, you get the vaccine because that's protection. Well, who's it protection for? For you or for others? And we often hear that it's a pandemic of the unvaccinated, and the unvaccinated have to get vaccinated so that the vaccinated are protected. I don't know how much sense that makes to anybody else. Not a whole lot to me. But if they're saying that you have to get unvaccinated so you're not spreading it to others, that's one thing. If they're saying that you've got to get vaccinated so you're not catching it, that's another thing. But we are going to address both of those right now. We've already addressed the one. where you're just as likely, or Omicron. I mean, word it. I mean, be very careful how to word it. Omicron is vaccine resistant, and we already heard the director of CDC saying that most all cases now 70+%, and that was in December. So I think it's up to 80-90% of all current cases of COVID are Omicron, because Omicron is spreading significantly faster, but it is less deadly, it's less severe. That being said, it's also more resistant to the vaccine. So our current vaccines that are out there are not working as well against Omicron, which is the variant that most people are currently getting. So a little trouble with that. We will read in a bit about the transmission. So we've already talked about the resistance of the vaccines, right? So you're still, from what I'm understanding, and I'm not a doctor and I'm not stating this as science, but from what I'm reading and what I'm understanding, you are basically just as likely to get the Omicron variant, whether or not you are vaccinated. Okay, stay with me on that. Let's go to this next article from The Hill. Biden calls on employers to mandate vaccine despite Supreme Court ruling. So we already heard where Supreme Court knocked it down. Some of those in the Supreme Court are upset about that. And of course, Biden's upset about that. He's still pushing employers to move forward with the mandates anyway, despite the Supreme Court knocking it down. And, you know, independent individual employers have the right to do whatever as far as that goes. I've always been of the mindset that if they're not mandated by the federal government, and the companies like Pfizer and Moderna and whatnot have been have been released from any responsibilities of any negative side effects or any complications with the vaccines, then if your employer forces you to get the vaccine, then your employer then takes on that responsibility, because no one else is responsible for it and for you getting it. The makers are not held liable. The government did not force them to mandate it to you, and you weren't forced by the government. You were forced by your employer. So I'm not saying that you can make a case there, but I'm certainly of the mindset that if your employer is forcing you to get it, then your employer is the one that should be held accountable if there were any kind of complications or issues that you may have due to the vaccine. So again, here he is pushing the vaccine anyway. President Biden on Thursday appealed to states and companies to require people to get vaccinated against the coronavirus, despite the Supreme Court blocking his vaccine or test mandate for large employers. Another one, let's see, from Fox News. Colleges adding COVID-19 restrictions as classes prepare to resume. Excuse me. The pandemic has forced some higher education institutions to shift remote learning and enact safety protocols some find too invasive. So colleges are enacting mandates, restrictions, what have you, some of which make sense. If you want to have some of those restrictions that we've had before in the past, the social distancing, the mask, even though they are not the most effective things, and the Omicron variant doesn't seem to be, everything that the original strain was as far as its impact on everybody, or depth of impact, I guess you would say. It is impacting more people because it's spread easier, but it's not as volatile, it's not as deadly, it's not as impactful to the immune system. So that being said, I do get some, caution that they're trying to throw out there. I do. I won't give them a hard time about that. But when you start implementing mandates on certain things and going a little overboard, I kind of concerned about your sanity there. But we'll go on to this next one here from Insider. New trucking vaccine mandate is likely to make fruit and vegetables more expensive. That's what this article says. I'm going to say even more than that, though, not just fruits and vegetables. And this is specifically talking about, at first anyway, truckers entering Canada from the United States, because they've already had the mandate. The United States will implement the mandate starting tomorrow. So we're going to see how that goes here for us. So let's read through this real quick. Vaccine mandates for truckers who haul goods over the U.S.-Canada border could cause price hikes. The CEO of Canada Wide Fruits told Bloomberg the cost of transporting produce climbed 25% last week. Canada imposed the mandate on Saturday, and the U.S. plans to require vaccine passports on January 22nd, which is tomorrow. Going down here, new vaccine mandates for truck drivers are likely to increase the cost of produce. The cost of transporting fruit from California and Arizona to Canada climbed 25% last week. Yada, yada, yada. And like I said, anything that's involving the truckers is going to involve price increases for all kinds of things, not just fruits and vegetables. I see their point. They're talking about that specifically, and they can add a solid number to it. But lack of truckers able to cross the Canadian border is not great for them. Mandates again for the U.S. are starting tomorrow. I've always been big on you don't mess with truckers. My brother was a trucker. I got a lot of friends that have been truckers or are truckers, and I will tell you that they are the heartbeat of this country. You know, we talk about nurses and we talk about doctors and we talk about, first responders as being heroes and the heartbeat of this country and everything. And I get that. And they absolutely 100% are. But so are, truck drivers. So are those that function our trains that move our stuff along, which what's going on in California with the trains. If you don't know what I'm talking about, look it up. They're robbing trains again in California, and people aren't being prosecuted for it. Or if they are, it's being instead of a felony charge, which tampering with the mail is most certainly a felony charge, it's being dumbed down to like a misdemeanor, a slap on the wrist or whatever for reasons. So anyways, don't mess with truckers. Truckers, if you're a trucker out there, God bless you, do your thing. All right, let's go on over here. What we got? Carhartt. All right, so I've got Carhartt clothing. I know a lot of people that wear Carhartt clothing. I remember seeing buddies posting that, folks wear Carhartt, they don't do Carhartt work. So I think a lot of this is actually from that. People that have pushed and supported this mandate from Carhartt that probably don't wear Carhartt or don't have any intention to wear it. They say they do, but they're the same people that say they're going to support, like Ghostbusters 2016 or, the 355, which we'll get to in a minute. And they don't actually go out in the theaters and buy tickets or anything like that. They just support from a Twitter a post or something like that. It's not exactly the same thing, but I digress. We'll look at a couple real quick here. We've got this post on Twitter. It says, "Wow, Carhartt, I'm impressed. I will be purchasing from a company that cares about protecting all its workers. Thank you for not making the issue political and for believing in science. We need more companies like yours." So just to catch you up, if you hadn't already heard, Carhartt is pushing forward the vaccine mandate for their employees. They're one of the companies, and I think the reason they're making the headlines more so is they're one that you wouldn't expect, because Carhartt is kind of the working man's clothing line, middle America, places that aren't so pro mandate. They seem to be pushing that on folks, and it's the workers may or may not be totally enthused about it, but the customers are definitely torn. Now, this is from Newsbreak that I'm reading here, and it's clearly a biased write-up organization. Like the title, Carhartt reportedly sticks to company vaccine mandate, horse medicine Twitter losing it. Horse medicine Twitter. So they're talking about ivermectin, which we have proven on this show and several other shows that ivermectin is a medication that's been around for so long, and it is in horse dewormer, but it is not horse dewormer. It is a people medication. So, here they go throwing that out there. If we go on down, I just wanted to hit a couple of them. Here's one from Elijah Schaefer. "Wow, Carhartt is subjecting their employees to medical abuse. Very bad look. Definitely should stop buying their products if you do." And below it says, "We won't be adding too many of these opinions, just illustrating what's out there." So, again, obviously a biased article, biased post on the subject. I want to say I saw The Quartering. Yeah, I watched Quartering. Great show. Good guy over there. But yeah, so people are stupid. Let me just say that. When there's a brand that does something you don't like, and you go out and you burn the clothes that you've already spent hundreds or thousands of dollars on, doesn't make a whole lot of sense. It just hurts you more than anybody else. If you already bought it, they already got your money, no big deal. If you don't want to support them, that's fine. When Netflix had cuties out there, and I think they still do, a lot of people protested by canceling their subscription because of the, potentially pedo style show that Cuties was, right? People were protesting Dave Chappelle and dropping their Netflix. People may protest Carhartt and say, I don't want to buy any Carhartt. That's fine. You have every right to protest, and I support you 100% in what you do. Just don't be stupid. Don't go out and burn buildings down and make people lose their jobs, and don't burn the stuff that you already have. If you don't want to wear Carhartt anymore, that's cool. Don't wear it. Donate it so somebody else can get it. Give it away to somebody else. It's just ridiculously dumb, I think, to burn it. I understand that you're sending a message, but you're sending another message. You just want to burn through your money. I don't get it. Plus, I'm pretty sure it's hazardous to the environment burning that good quality stuff, because it is good quality stuff. I just bought a jacket from not long ago because I'm a fat boy, and it fits great. And that jacket probably weighs as much as my 9-year-old child does. It's just heavy. It's good quality stuff. And I like Carhartt brand. They got to make the decisions they're going to make, and the employees that work for them got to make the decisions that they want to make. But it's just interesting to see that people are saying that they're following the science. And again, we're disproving the science here that everyone's following. What do we got next? What is the point of the mandates? Is it so that you don't get sick, or so you don't spread the virus? That's the questions that we keep asking, right? We've already said that you can still catch it even if you're vaccinated. So this doesn't help. The mandates don't help you, keep you from getting it necessarily, right? So maybe the idea is to keep you from spreading it. Okay, let's look at this next article right here. Last one, we're going to wrap up with this one. So can fully vaccinated people spread the Omicron variant to others? What the CDC says, CDC, Centers for Disease Control, has confirmed that anyone, regardless of vaccination status, can likely spread the Omicron variant of the coronavirus to other people. The Omicron variant likely will spread more easily than the original SARS-CoV-2 virus, and how easily Omicron spreads compared to Delta remains unknown. According to the CDC expects that anyone with Omicron infection can spread the virus to others, even if they are vaccinated or don't have symptoms. Full stop. So we've got the CDC, medical journals, articles, whatever, saying that you can still catch it whether you're vaccinated or not. And now we're seeing from the CDC, they're also saying you can still give it to people whether you're vaccinated or not. So what is the point of the vaccine mandates? You still carry it. You still catch it. You still transmit it to others, vaccinated or not. I'm not a scientist. I'm not a doctor. I'm just reading these stories. What's the purpose? What's the point? Who is it really protecting? Conspiracy theorists are out there, drawing the lines, figuring out what's in there and who's controlling what. And I'm not going that deep, but it's pretty clear to see that you can transmit it. You can still get it whether you're vaccinated or not. So the vaccine mandates seem to be pretty bunk to me.
Dr. Walensky, really quickly here, not much time. Cases are rising fast. We know this new variant is so transmissible. There have been so many breakthrough cases. Is it reasonable to expect at this point that everyone's just going to get COVID and your outcome is going to pretty much depend on your vaccination status?
Certainly your outcome is going to depend on your vaccination status. We have seen time and time again. In fact, data just released again last week demonstrated that you're 20 times more likely to die from COVID if you're unvaccinated compared to if you're boosted. 10 times more likely to be a case if you're unvaccinated compared to if you're boosted. I do think that we will see that those who are vaccinated and boosted will have less severe outcomes, less risk of mortality. There are going to be breakthrough cases of Omicron, and they will be cases, but they will be certainly milder if you're vaccinated and boosted.
Again, she does a great job at her job, right? Which is not answer questions, apparently. So the question was, is everybody just going to get it? And instead of answering that question, she said that the difference between vaccinated and unvaccinated for how you will deal with the virus when you get it, right? That vaccinated people will fare better, usually, than people that are unvaccinated if you catch it. But the question was, is everybody pretty much going to catch it? Is everybody going to be transmitting it and catching it, and it doesn't matter if you're vaccinated or not? She didn't answer the question. But everything we have shows it's incredibly likely that anybody, vaccinated or not, can catch it, carry it, transmit it.
Hey guys, thanks for checking out this clip from the Morning Mayhem. Remember, this is just a portion of the full show that comes out every Friday morning at 10 a.m. Eastern Time. If you hadn't already, don't forget to subscribe so you don't miss out on any of the full shows or these tasty little nuggets.